Hi friends, welcome to Dr. Ram's Medical Coding Academy. We are actually seeing a series of code changes, especially in the CPT manual. In the previous video, I've discussed the changes in the EM section, which is the Evaluation and Management Service. In this video, I'm going to kickstart with the surgical changes. So let's first start with the integumentary system. As you all know, integument means an envelope or a layer. This system includes the skin, the various glands, the hair, as well as the nail. In the CPT book, you find that the 1 series codes are used not only for the dermatologic or the cosmetic procedures, but we also find so many procedures listed under the plastic surgeries or the wound care procedures. Plus, we also have a section for the procedures exclusively on the human breast. Going straight to the code changes, we see that there are 8 new codes being added and 1 code has been deleted. At the same time, there is no revised code, which means there is not a revision found in any of these existing CPT codes. Though you find that the count is high as 8, but all these codes are for a particular therapy, which we are going to discuss in detail in this video. In the 1 series, we have extensive codes for plastic surgery procedures or for reconstructive purposes. There are so much of graft codes like the epidermal graft, dermal graft, muscular cutaneous grafts, and all that. Plus, we also have a full thickness graft or a split thickness or a partial thickness graft. The new codes are actually being added under the subsection of the skin replacement surgeries. We are going to find a different kind of a technique in which the skin conditions can be treated by applying this therapy. We call that as a skin cell suspension autograft therapy. Let's quickly talk about that therapy. The code set under this therapy is primarily reported for burn treatment and skin trauma such as degloving. The new technology differs from other types of skin autograft like partial or a full thickness grafting, where grafts are meshed to expand 1:2. Instead, in the SCSA method, which is this novel therapy, it expands to 1:80, allowing for much less skin to be harvested for a much greater defect coverage. Let's go through the medical terminologies associated with this suspension. SCSA, when expanded, it is skin cell suspension autograft. So when we talk about the skin cells, we are going to obtain the cells from the epidermis as well as the dermis. Epidermis is the outermost avascular layer, which is also called the cuticle, and dermis being the true skin. There is a suspension which is going to be made by the doctor, which is a liquid solution, and that's going to contain the cells that are being obtained from the patient. Since the treatment is going to involve the patient's own cells, we call that as an autologous therapy, or we say it as an autograft. So as you know, the word autograft can be broken down into auto plus graft. Auto refers self and graft refers to the flap or the tissue. Well, just have a cursory look at the anatomy of skin. We know that the epidermis is in several layers. We call them as strata. We have the stratum corneum, lucidum, granulosum, spinosum, and basal. And then the epidermis having the papillary as well as the reticulate layer. And underneath the dermis, we have the hypodermis. The physician is going to obtain the cells from the dermis as well as the epidermis. The question arises as to how the physician is going to obtain the cells. So we have a very simple technique of biopsy. I hope you know that the word meaning of biopsy we can understand just by splitting it as bio plus opsy. Bio means life and opsy means to see or visualize. Biopsy is a technique of sampling the living tissues. In the dermatology section, you have different types of biopsy as tangential or shave biopsy, punch biopsy, incisional biopsy. The doctor is going to obtain the skin samples via biopsy. Now let's see the skin cells which are going to be harvested. In the epidermis, we have the uppermost layer, which is stratum corneum. Now, corneum is nothing but made of a protein called as keratin. This protein is being produced by the keratinocyte. We can break this down as keratin plus cyte. Keratin as a skin protein, which is going to offer us a structural integrity of our skin, and cyte referring to cell. Melanocyte, we can break it down as melanocyte. The word melano, the Greek word melano, actually means black. So this is a black pigment which is going to protect the skin from the harmful ultraviolet radiations. Just because the Western population is devoid of melanin, they suffer from neoplastic and cancerous conditions. A white man developing a skin cancer is like a person developing a cough, according to me. Just because of the absence of melanin, a person is exposed to all kinds of neoplastic conditions. Skin cancers are unheard of in the negroid population. Then we have the fibroblast. Now these are nothing but the cells which are found in the dermis. Now these are blast. Whenever I use a suffix is blast, which means these are precursors to cells. Now they help up in building up this collagen and the extracellular matrix. You can see the cells, especially the keratinocytes, the melanocytes, and the fibroblasts. The keratinocytes are like flatter cells, melanocytes are smaller, whereas a fibroblast you can see having this fibrous appearance. The doctor is going to obtain these cells and then he is going to do a preparation called as a suspension. You can see that a suspension has been produced here in a test tube with the skin cells. The suspension in autologous skin cell suspension refers to a liquid solution containing the patient's own cells. The liquid allows the cells to be easily spread over the wound or treatment area, ensuring even distribution and promoting skin regeneration. This approach is commonly used in treatments for burns, chronic wounds, and depigmentation disorders like vitiligo. Let's see what are these components that make up the suspension. As you all know, we have the skin cells obtained by the process of biopsy. The next step in creating the suspension, the harvested skin sample is treated with enzymes like trypsin or collagenase to separate the cells from the tissue through an enzymatic digest. The separated cells are then suspended in a sterile liquid, often a saline or a culture medium. This helps maintain the viability of the cells during preparation and application. We have a nutrient-rich medium. Optionally, the physician can also add some stabilizing additives. Some suspension may include stabilizers or growth factors to enhance the cell's functionality. What are the indications for this therapy? Patient needs to present with certain dermatologic conditions or ulcerative conditions like diabetic ulcers or venous ulcers or autoimmune conditions like vitiligo. This therapy is efficacious in the treatment of burns and traumatic injuries. ACS is an advanced, minimally invasive therapeutic technique used in regenerative medicine, particularly for treating burns, chronic wounds, and conditions like vitiligo. In treating conditions like vitiligo, it causes repigmentation of depigmented skin through the transplantation of melanocytes. Well, how is this therapy actually being done? Let's dive into the key components of this therapy. First one, as we all know, is harvest. Harvesting is nothing but the obtaining of the cells from the patient himself. Here is a first step involved, which is harvesting, that is the isolation of the skin cells. Secondly, it is a preparation or formation of a suspension with these isolated skin cells and then treating with those enzymes. And thirdly, it is the application. Here, we are actually going to spray over the wounds or the injured parts of the person. Lastly, the physician can also apply a proper dressing. In application, the suspension is evenly applied over the wound or burn or lesion after the area has been prepared. We have got a total of 8 codes. 2 codes are for harvesting, 2 codes are for preparation, and 4 codes are for application. We will see why there are 4 codes for application. Well, the harvest codes are 15011, which says harvest of skin for skin cell suspension autograft first 25 square centimeter or less. We also have an add-on code 15012, which is for harvest of skin for skin cell suspension autograft each additional 25 square centimeter or part thereof. Let's move on to the code sets for preparation. We have got two codes here as well. 15013 says preparation of skin cell suspension autograft requiring enzymatic processing, manual mechanical disaggregation of skin cells, and filtration, first 25 square centimeter or less of harvested skin. And then we also have this add-on code which is 15014, wherein you can report when there is an additional 25 square centimeter of the harvested skin. With preparation, you can figure out what kind of a method the physician is employing. So firstly, this can be an enzymatic processing and then a manual or a mechanical disaggregation. Now the word disaggregation refers simply to isolation and then filtration. Coming to the application code sets, I told you that there are 4 codes. Now these codes are evenly distributed based on the anatomic sites. So here, as usual, we have got 2 such grouping. One is for trunk, arms, legs. So I use the tell as TAL, TAL, trunk, arms, legs. So one is for the TAL region and the other is for the non-TAL region. So that's specifically for face, scalp, eyelids, mouth, neck, ears, orbits, genitalia, hands, feet, digits. Well, what's a generic descriptor for the application codes? Here you can see application of skin cell suspension autograft to wound and Jonard sites, including application of primary dressing. Here you need to be watchful of the area that is being treated, which is first 480 square centimeter or less. Now for the TAL region, which is trunk, arm, legs, we have codes 15015, 15016 and 16. This is an add-on code. Same way for the non-TAL region, other than trunk, arms, legs, you can report 15017 and the add-on code 15018. Let's see the benefits. Why has a CPT editorial panel has recommended the usage of this therapy? Why have we got new codes for this therapy? We understand that there are inherently certain advantages. Now let's see what are these. Since it is an autograft, so it is of an autologous nature, as the cells are being harvested from the patient's own body. So there are no chances of rejection or failure. Because if it is going to be a synthetic substance, then there can be a chance of a foreign body reaction or a transplant failure. Secondly, it is minimally invasive, where it requires only a small biopsy, preserving most of the healthy skin. Thirdly, for an efficient coverage, because a small biopsy can treat a much larger area. If you're aware, a 1 square centimeter of the harvested skin can treat up to 80 square centimeter of the affected wound. Moreover, this technique reduces the post-operative complication of scarring as it promotes natural regeneration, which may improve cosmetic outcomes. We are done with this entire therapy. I hope you have understood all these new codes especially. Just this therapy has got 8 new codes, 2 for harvesting, 2 for preparation and 4 for application. There is no revision for this year in the integumentary system. But then there's a deleted code. Before moving on to the deleted code, I would like to give a very brief introduction of myself if you're watching this video for the first time. I am Dr. Ramasubbu, who's basically a homeopath. I've done my B.Sc in psychology from Madras University and then did my MSc in psychotherapy. I've done a diploma in Bach remedies and then I proceeded to take up the homeopathic medicine, which is BHMS, wherein I was a college topper. And then I also took up the MD. I was running my own clinic and at the same time I also entered into this field of medical coding. Now this industry had so many exams to clear. I have cheerfully cleared 33 coding and healthcare certifications from AAPC. I had been the All India topper of AAPC and acted as a speaker twice in the years 2015 and 18 for Chennai chapter. As of now, I am the director of Dr. Ram's Medical Coding Academy. I have had more than 3,000 students both from India and abroad as well. So there are 2 levels of training. One is level 1, which is for a freshers level. The training takes place during the weekdays, just 2 hours a day. And level 2 is exclusively for the examination training, specifically the CPT exam training. If you're interested, you can please contact this number which you can see here. Well, let's get back to our topic. We have to see this deleted code. There's just one deleted code which is represented by the CPT 15859, which indicates cervicoplasty. Now, if you don't understand what this procedure is, very simple, break this word. Cervicoplasty equals cervix plus plasty. Now, the cervix refers to the neck and plasty refers to the plastic surgery. Now, that's considered a direct neck lift procedure. So, wherein the doctor is going to strengthen the muscles of the neck. This procedure is mostly concerned with cosmetic surgery, and I hope that was the reason as to why the CPT editorial panel has decided to do away with this code. We have come to this end of this video, and if you have got any questions, you can please post your questions or queries in the comment section, and I will respond as soon as possible. If you feel that this video was informative, you can please like this video, share it, and subscribe and hit the bell icon so that you will receive all our future videos. In the next video, I'll be talking about the surgical changes in the orthopedic system. I would request you to watch that video as well. And for our viewers in Hindi, you can listen to all these coding classes in Hindi as well. I will see you in the next video. Thank you.